Welcome everyone to Bone Voyage, a podcast dedicated to prevention and raising awareness of musculoskeletal disease. My name is Dr. Kranti Peddada, an orthopedic surgeon, bone and joint health advocate, and your host for this show. Come join me as we embark on this journey to better bone and joint health. Welcome everyone to the final episode in our bone health series. Until now, we have reviewed several topics, including bone biology, how to maintain good bone health through diet and exercise, and osteoporosis. In this episode, we're going to bring everything home by summarizing and connecting key points from all these topics. As always, please keep in mind that everything presented here is purely informational, should not be interpreted as medical advice, and does not create a doctor-patient relationship. Please consult a physician or another qualified healthcare provider with any questions you have regarding a medical condition and before you make any changes in your healthcare behavior. Please reference the episode description for a full disclaimer. With that, let's get right into it. Bones have numerous functions in our body, such as providing structural support and enabling movement. Bones also serve as a reservoir of calcium and phosphorus, which are minerals that play vital roles in our body, including providing bones with strength. This reservoir stays full when we consume enough calcium and vitamin D, but shrinks when our intake is inadequate. Years of deficiency can lead to loss of bone mass as more calcium and phosphorus is extracted to supply the body's needs if they are not sufficiently replenished with diet. Once we reach our peak bone mass in our mid-20s, our body's bone metabolism changes. At best, we can maintain our bone mass, but not build more bone in a significant amount. This is why maximizing our bone mass through early adulthood with diet and exercise is so important, because any bone loss later in life is largely irreversible. Women are particularly susceptible to significant bone loss after menopause because of estrogen loss. Estrogen helps regulate the balance of bone formation and bone breakdown in our body, and estrogen loss after menopause tilts the balance to more bone breakdown. We can ensure our bones stay strong by consuming enough calcium and vitamin D. The daily recommended calcium intake for adults is 1,000 milligrams, but increases to 1,200 milligrams for women after menopause and all adults after 70 years. The best natural sources of calcium are dairy products, seafood with bones, and green leafy vegetables. Oral calcium supplementation with calcium carbonate, calcium citrate, or multivitamin tablets may be necessary to reach our daily calcium goal. Be sure not to consume more than 500 milligrams at once though, since our gut does not absorb quantities that large very well. The recommended daily amount of vitamin D is 600 international units for individuals under 70 and 800 international units for those over 70. Our skin naturally synthesizes vitamin D using UVB radiation and sunlight, but this is not a reliable method of getting enough vitamin D because there is too much variability based on the weather, area of the world we live in, and an individual skin type. Too much sun exposure can also lead to skin damage and skin cancer. The most reliable way to get vitamin D is through certain seafoods such as salmon and trout, fish liver oils, foods fortified with vitamin D such as dairy products, and oral supplements. Foods alone are unlikely to provide sufficient vitamin D, so consider taking a vitamin D supplement or multivitamin to make up for the difference. Consult with your healthcare provider to ensure you are getting enough calcium and vitamin D. You may need to consume more if you have certain medical problems or a known deficiency. In addition to a diet rich in calcium and vitamin D, exercise is also necessary to keep bones strong. An appropriate amount of mechanical stress on bones in the form of weight-bearing exercises and resistance training is necessary for bones to maintain their strength. Too much stress can cause bones to break, while too little stress can cause bones to thin over time. Weight-bearing exercises, such as brisk walking, running, dancing, and sports such as basketball and pickleball are great for your leg, pelvic, and spine bones. Upper body resistance training such as weightlifting and use of resistance bands are great for your arm bones. 30 minutes of weight-bearing exercise 4 to 5 days per week and upper body resistance training at least twice per week is recommended. If you make weight-bearing exercises an aerobic activity, then you can conveniently keep your bones and heart healthy at the same time. As we get older, we will inevitably lose some bone mass. This is a normal part of aging. However, losing too much bone beyond a certain threshold can make your bones fragile, making them susceptible to breaking with minimal impact. This disease of low bone mass is called osteoporosis and is the most common bone disease worldwide. Older women are at highest risk because of estrogen loss after menopause. Other risk factors include having a family history of osteoporosis, smoking, and consuming more than 2 alcoholic drinks per day. All women 65 years and older, and possibly men 70 and older, should be screened for osteoporosis with a DEXA scan. A DEXA scan provides a bone density score that is the basis for diagnosing osteoporosis. Those with osteopenia, which is low bone density not meeting criteria for osteoporosis, should be closely monitored with a repeat DEXA scan at an interval determined by their healthcare provider. If you are diagnosed with osteoporosis, medical therapy is recommended to improve your bone density and strength because you cannot naturally build more bone after peak bone mass is reached. Several different medical therapies for osteoporosis are available, and your healthcare provider will help you determine which is best based on your coexisting medical conditions, the side effect profiles of different medications, and the severity of your disease. Building enough bone mass is a long process, and despite the type of medication, it can take several years. The reason we treat osteoporosis is to prevent fractures. The wrist, spine, and hip are the most common bones to break in somebody with osteoporosis. These fractures occur with minimal impact, like falling from a standing height. Spine fractures are the most common, but hip fractures can have the most devastating impact. Around 1 in 5 people after a hip fracture lose their ability to live independently and end up moving to an assisted living facility or nursing home. At least 20% of people die within 1 year after a hip fracture, which is about the same death rate as after a heart attack. Aside from medical therapy, fall prevention is also important for people with osteoporosis. After all, it's hard to break your hip if you don't fall, despite having bones that are weak. The problem is that about 1 in 4 adults over 65 fall each year, and this is the same age group at risk for osteoporosis. Activities such as yoga and Tai Chi are great for improving muscle balance and coordination and have been shown to reduce the risk of falls. A physical therapy program focused on the same has proven benefit as well. For those who cannot reduce their fall risk with these methods, using a mobility aid, such as a cane or a walker, may be necessary. This two-pronged approach of medical therapy and fall risk reduction is the most effective way of preventing hip fractures in people with osteoporosis. But the best prevention strategy of all is maintaining good bone health throughout your life. A small daily investment in your bone health through appropriate calcium and vitamin D intake and exercise will reduce your risk of osteoporosis and its complications. With that, I wish everyone listening bon voyage. You are well on your way to better bone and joint health. Thank you for listening.
Thank you for tuning in to this episode of Bon Voyage, your journey to better bone and joint health. Please join us on Wednesdays for new episodes. If there are certain topics you would like to listen to, or if you have feedback for the show, please email us at bonvoyagehealth@gmail.com. If you enjoy listening, please follow and subscribe to our podcast. Thank you for all your support.